Hello everyone, welcome to Tech Sharmit. In this session, we will discuss about few more medical terminology related prefixes which is used in order to denote information related to body part. Okay, so in previous session also we have discussed some prefixes which is related to the body part itself. So this session is in the continuation of the same and we are discussing it in part 23. So if you have not watched the previous session, I recommend you to go and check out the entire playlist from sequence because everything is explained in a detailed manner. So that would be much easier for you if you are following the proper sequence. But for those who are directly referring the session, let me repeat the definition for the prefix because this is the main thing that we are going to discuss today. So prefix is a word that is used in order to denote some information, which could be body part, shape, color, or anything, right? And it always attaches with the at the beginning of any medical terminology. So this type of word is known as prefix, okay, which comes at the beginning of the word or terminology. Now, in this session, how we are going to proceed? First of all, I'll tell you few prefixes with their meaning. Once it is clear, then we will jump for the examples because examples are very important, right? Because with the help of examples only we will be able to understand the actual meaning, and then later whenever we are maybe in exam or interview, by just looking at the example you can easily identify what type of prefix has been used there and what all information is provided by those prefixes. Okay, so let's start with the session. The first uh, point is cephal. First prefix is cephal or cephalo. Now, what is cephal or cephalo? Whenever we want to discuss something related to head is a part of body. So, whenever we are going to discuss anything about head, then we will use prefix cephal or cephalo. Clear? So, this is just the definition. Now, when we look at the examples, then it would be more clear. So, just look at the first example, which is cephalid. Now, what is cephalid? Cephalid means toward the head or in the direction of the head. Toward the head or in the direction of the head. So you can see here we are talking about head. We are indicating, we are navigating towards head. So to navigate towards head, we are using the terminology cephalid, which is started with the prefix cephal. Then we have cephalalgia. Now what is cephalalgia? Headache or pain in the head. So this type of situation when there is a pain in the head, or you can say in other way that patient is suffering from headache, then in that case we can use the terminology cephalalgia. Cephalalgia. Okay. Likewise, if you look at the third example, which is cephalometry. Now, what is cephalometry? Cephalometry is a process in which the measurement of the dimensions of head has been taken, maybe for some medical purposes, for some treatment purposes. If the head is measured, then in that case, the measurement of the dimension for the head is taken. Then in that case, we will use the terminology cephalometry, which is started with the prefix cephalo. You got my point? Fine. Then we have next example, which is cephalic flexure. Now, what is cephalic flexure? Cephalic flexure is the curve between the brainstem and forebrain. The curve between the brainstem and the forebrain. So now if you look at all the examples again from top to bottom, then you will find that only one thing is common which is present in all of these examples, which is head. And that's the reason we are using the terminology prefix as cephal or cephalo. Okay. So this is all about the cephal or cephalo prefix which is used to denote head. Now we will look at the next prefix. Next prefix is col. Now what is col? It is always related to bile. So whenever there is a discussion related to bile, then in that case we will use the prefix col. Now look at the examples. First example is cholerasis. What is cholerasis? The secretion or flow of bile. So whenever there is a proper secretion or flow of the bile, then in that case we can utilize the terminology cholerasis, which is started with the prefix col. Then we have colorectic. Now what is colorectic? It is just a substance that promotes the secretion of bile. For some medical region, let's say if we want to promote the secretion of bile in a body, then we will use one substance, and then that substance is known as colorectic substance that promotes the secretion of bile. Similarly, if you look at the next example, which is cholestasis. Cholestasis means impaired flow of bile from the liver. So whenever there is an impaired flow of bile from the liver, then we will use the terminology cholestasis, which is started with the prefix col. Now look at the last example for this prefix, which is cholecytokinin. Cholecytokinin. Now what is this? It's a hormone that stimulates the release of bile from the gallbladder and the pancreatic enzyme. So whenever there is a stimulation of hormone that releases the bile from the gallbladder and pancreatic enzymes, then we will use the terminology cholecytokinin. Cholecytokinin. Now what is common here in all these examples? Obviously bile. Everything is related to bile. Somewhere we are talking about the secretion or flow of the bile. Somewhere we are talking about the substance which promotes the secretion of bile. And in one example, we are talking about the impaired flow of bile from the liver. So this is the reason why we are using the same kind of prefix, which is col, which denotes the information related to bile. Okay, fine. So far we have discussed two prefixes, which is cephal or cephalo, used to denote head, col, which is used to denote bile, and now the next prefix is chondri or maybe chondro. Okay, so what is that? This prefix is mainly used in order to showcase something as cartilage. So whenever there is a discussion related to cartilage, we will use either chondri or you can consider chondro, because both are related terms, chondri or chondro. So these two terms are used in order to showcase something as cartilage or in order to provide the information related to cartilage. Now look at the first example, which is chondrocyte. What is chondrocyte? Chondrocyte is a mature cartilage cell in a body. Okay. Similarly, if you look at the second example, which is chondroitin sulfate. Now what is chondroitin sulfate? A compound found in the cartilage, bone and connective tissue. A compound found in the cartilage, bone and connective tissue. So this thing we will denote with the help of chondroitin sulfate. Likewise, if you look at the next example, which is chondrogenesis, as I have told you previously also, whenever there is a suffix, not prefix, suffix genesis, it means there is a something formation or development. So here also the process of cartilage formation during the embryonic development. Then this process will be defined with the help of medical terminology chondrogenesis. So chondrogenesis is a medical terminology which is started with the prefix chondro. Okay, fine. Then we have next and last example for this prefix, which is chondrostrophy. Now what is chondrostrophy? Abnormal development of growth of cartilage. Abnormal development or growth of the cartilage. So yeah, these are the all prefixes which I would like to share with you all in this session. I hope it is clear to all of you. And in the next session we will discuss few more prefixes. And for today there is one question for you, like what information is provided by the prefix burso and carcino. I recommend you to put the answer in the comment section by sharing your knowledge so that other can take a reference from it. But if you have any doubt in this topic or in these prefixes, then you can refer the preface session, because there we have already discussed about them. So yeah, that's all for today. In the next session we will discuss few more things. So thank you for watching Tech Sharmit.